Hello, I'm Dr. Evan.
And I'm Dr. Zach.
And we're with Advantage Chiropractic, and this care package was made for you. It was given to you by a loved one, a friend, a family member, really to talk about shoulder pain and where it comes from. So that's number one we're going to talk about. Number two, we'll talk about what you can do at home to combat that shoulder pain. And then number three, we're going to give you some action steps to really start correcting that shoulder pain so you don't have to deal with it anymore. Because shoulder pain comes from three main components within the body. Number one comes from the structural component. Number two, there's a muscular component. And then number three, last but certainly not least, there's a neurological component.
Exactly. So let's break those three components down and start with the structural aspect when it comes to any shoulder pain that you might be having. So number one, we're looking at the structural piece. When we look at the neck, we want to have a nice C curve just like this. And those nerves in that bottom part of the C are the same exact nerves that go out and control all shoulder function, muscles, tissues, everything that goes out there. So if we don't have a proper structure, so a proper curve, and that neck straightens out or even goes the opposite way, it can lead to a lot of that shoulder pain. The second thing is the muscular aspect. If that's you out playing ball all day, if that was a car accident that you may have gotten in, or a strenuous activity sitting at work like this all day, those muscles can really start to tense up in the shoulders, obviously leading to some of that pain and soreness that you can be having. And third, most importantly, as I kind of just touched on a minute ago, is the neurological component to the shoulder pain that you might be having. So those nerves, especially again in that lower part of the neck, go out and control all those muscles. If those nerves aren't functioning properly, those muscles aren't going to be functioning properly, the shoulder's not going to be functioning properly. So we have to get those nerves functioning properly to alleviate the shoulder pain that you are having. All right, so we're gonna talk about some stretches and exercises when we're having that shoulder pain we've been talking about. So the first one is called Brugger's position. So what I'm gonna have Dr. Evan do is put his hands down to his side, palms forward, and what he's gonna focus on here, he's gonna roll his shoulders up and back, and he's gonna pinch his shoulder blade together, really pinching those shoulder blades and opening up that whole chest cavity. That's gonna help with that shoulder girdle, help loosen some of those muscles, and really alleviate some of that shoulder pain. The next one we're gonna do is gonna be external rotations with his shoulder. So what he's gonna do is sit in this great position just like that, thumbs up to the ceiling. The big thing here is maintaining his elbows in at his sides. I don't ever want these elbows to flare out when he's doing this exercise. So all he's gonna do is just externally rotate his arms out. Perfect. You can feel a light stretch. We're gonna hold it for a couple seconds. We're gonna come back in. Like I stated before, don't let your elbows flare out. Keep them nice and close to your side as he rotates all the way out. So what I want you to do is perform 10 of these at a time. The third and final one we're going to share today is going to be the pec stretch using a door or a doorway, okay? So we're going to use this wall for an example right here. What Dr. Evan is going to do is going to keep his palm against the wall. He's again going to keep his elbow against the wall. And with his inside leg, he's going to step through his body and rotate out that way. So the big thing is we're going to start stretching his whole shoulder girdle this way. Again, I want you holding it for 10 seconds. Don't do it too long, and you can come back out. The big thing is if you're doing one arm at a time, we want you to do both arms. So you're obviously gonna have to switch around the other way and do your other shoulder at the same time, okay? So you guys remember, when you're doing any of these stretches or exercises, we don't want any pain. So we don't want any sharp shooting pain. We don't want a constant ache that's gonna last you all night. So if you're having any of that, please stop, give us a call, because we can make these individualized just for you. All right, guys, those are just some simple stretches and exercises and things you can be doing at home to really combat the problems that you've been having. So the big thing is we gotta see if it's neurological, if it's muscular, or if it's a bone issue, or a combination of those three.
Absolutely. So seeing as you have this video, it was sent to you by a loved one, a friend, we want to let you know that you have an opportunity for a completely complimentary consult and exam with us. And the goal with that is to really figure out if it is neurological, if it is structural, or if it is muscular, or those combinations that we were talking about, to really give you those answers on what you can do to really correct what's going on so you can live the life that you want to live. So if you have any questions, if you're interested in setting one of those up, call us at the office, 262-505-5610. You'll speak with Melissa or Sierra. Make sure you mention that you have one of these videos, and we'll ultimately get things moving in the right direction. Thank you so much, and as always, live the advantage.